The human anatomy is wired in a particular way, giving room for reactions either positive or negative. Due to the various senses, people react to actions differently. Low or high, every person experiences some form of reactions as a result of change, be it physical, emotional, or psychological. This is what the expert calls stress. Simply put, stress is the body's response to anything that requires attention or action, making stress a part of human nature. What makes the difference, however, is how the individual responds to stress. Naturally, the body's mechanism allows people to go through the process of stress to enable them perform daunting tasks or respond to threats of any magnitude. Stress has become an everyday routine. Research suggests that those who are affected most by stress and post-traumatic stresses are a section of the working class whose jobs are demanding. Research shows that protracted stress and post-traumatic stress over time can have negative health implications on the individual. The chemical reaction from stress is a helpful tool which, for instance, enables the individual to perform everyday activities such as exams, interviews, sporting activities, deal with relationship and family issues, rivalry, litigation, post-traumatic cases, bad news, among others. Nonetheless, stress by nature significantly affects our entire health. Unfortunately, most people tend to ignore the negative aftermath of stress in the short, medium, and long term, which is extremely dangerous to the human health. Global statistics on stress is alarming. Research shows that about 33% of cases reported to health facilities are with extreme stress, while 77% experience stress that affect their physical health. It goes on to say that about 73% of people have stress that impacts their mental health, while 48% have stress linked to sleeping. A pathologist consultant at the Ghana Standards Authority and former Director General of the Ghana Health Service, Professor Ajimanbedu Akosa, says stress can be linked to an organization undergoing fire drills to keep the system in good nick. So that the body requires a bit of stress to keep it in shape and focus to perform its functions effectively.
Stress is a normal component of everyday life. It is what pushes you to be up and going and do your work. And the body compensates. Once you finish doing your work, the body relaxes itself. Whilst you are in that stressful environment, the body pushes out a hormone called adrenaline. It makes your blood vessels constrict. It increases your pulse rate. It's almost as if you are running or you are frightened. That is what is called the flight-fright syndrome. That is the work of adrenaline. Now, as soon as that episode is gone, the body releases cortisol, and that then brings your pulse back to normal, brings your blood pressure back to normal, brings your breathing back to normal, so you become normal again. Now, that happens pretty much all the time. But if you get into a period of sustained activity, in other words, you are in a totally stressful environment, you are beside yourself, then what it means is that the stress continues for a longer time. You have a lot more adrenaline being pushed out, your pulse is up, your blood pressure is up, your breathing is up. Your whole body is in an agitated state. Now, even if you get into a calming down situation, it's not back to normal. So when cortisol rises, the cortisol gets prolonged for a long time. And cortisol becomes a mediator of inflammation. Even though things are getting back to normal, it doesn't come to normal as well as you would want it, And in a sustained, stressful environment, you get into almost a sustained, stressful environment. So you can see that some people are agitated. Some people are stressed. And some people are normally worriers. They worry all the time, even if they can't do anything about it. They worry. I mean, the kind of things that I would take in my stride, a lot of people can't take in their stride. So all these different scenarios creates that environment that we call stressful.
Talk about stress. We have so many kind of stress. It depends on the area you get it from. For example, like home stress, personally, my expectations turned upside down when I entered into marriage. What I was expecting or I did not see during dating, I start facing such problems. So I was so much stressed up to the extent that I cook, I eat, I feel like I've not even eaten. There was something mixing. I would sit at one place eating this, that, which had effect on me. And more so, expectation of childbirth. It wasn't coming because of other stress. You see your menses, when it's time, your menses will block or something might not come, that's pregnancy coming in, then you see blood flowing. You will be stressed up, but the more that you stress up, the more the situation continue. To de-stress myself, I want to be alone. Sometimes I watch films, I watch programs that I take delight in.
As human beings, we go through stress. But the interesting thing is, some people go through stress and they don't know whether it is even stress that they are going through. So it is individual and how you respond to it. Interestingly, there are some who don't even know that what they are doing or their reaction is through stress. Others also know how to handle their stress. When they are stressed up, they have other solutions to it. In my case, I try to keep quiet, or I try to find myself something doing. I play golf. So anytime I feel I'm overstressed, I go and play golf. I come and I'm relieved.
Sometimes I become stressed up due to maybe financial problems or maybe stuffs in the office. And how I go about it is, like the office, when I'm stressed up, what I do is I sometimes just get out of the office, walk around, think about things that I've done that will make me laugh. Or maybe I either go onto my phone, there are some videos that makes me laugh. Then I just open to that videos, watch it, and laugh, and then I'm off the stress. At home, maybe I'm not having money. And then my children has come and then they said school fees. My wife is also pulling me here and there. When I'm stressed up like that, the only thing I do is to walk out from the room, go outside, take fresh air, think about how to solve that problem. And through that, maybe I'll get a solution for it. So before I come back into the house, my problem will be solved, and that is it.
I do experience stress. Stress has become normal, especially in this economy. And when you wake up, the time you wake up around 4:30, you do a few house chores. By the time you drive to work, you close, you be in traffic. You get home very late, tired. The few hours you are waking up again. And it's normal. It's becoming normal in our society of late. So I do experience stress. Basically, I play games. Sometimes I hang around with friends and, swim, especially in the weekends. And then this is how I do normally to de-stress.
Scientifically, stress is grouped into two: environmental and internal stresses.
So stress is a state of being under pressure. It's a psychological state of mental and emotional strain that is demanding on you for something. And that demand, it depends on how one processes it. If you process, you can call it stimulus and response. The stimulus is what is getting to you. Number of people can have the same stimulus, and the way they process it, your response to that stimulus will make you feel the stress, how the degree for which you feel that stress. If you process it to be overwhelming, it will weigh you down. So that is stress. Stress is necessary in everyone's life. For us to get up and go about things and be motivated, we need a little bit of stress. And it's been there for ages, but Hans Sally defined it to be something that is demanding on yourself. It's there for a long time, but Hans Sally put it together as something that we should be aware of and take care of. So stress can be good and it can be bad. It is good because each and every one of us need a level of stress to carry out our duties, our everything in a very good manner, positive manner. For a student to study, to write an exam, to carry out any work meaningfully, you need some pressure from within, that is stress, to be able to do it well. But stress has we have three types of stress. That is, we have acute stress, we have episodic stress. Something else can happen to you immediately and puts a lot of strain on the individual. That is, and then after some time it goes away. When that task is gone, you're able to resolve it. You are not under stress any longer. But stress is chronic when it's coming and going every day. Every moment, every activity, your heart will be beating. You are not able to carry it through. You are overwhelmed with activities and it breaks down your system. You feel so weak, so overburdened emotionally and mentally. Then, and if it's continuous, then it's chronic. And that needs treatment, because that can color your life, because your mind will not be in a state of the way it can process information well to be able to carry out or to perform. So if you are a worker, you are not able to be productive. If you are students, you are not able to write your exam well and pass, because even before when the exam paper is before you, your heart is beating. You can't process your thoughts. That is, and it's continuous. That is chronic stress. We also have acute stress, which is close to episodic stress. That acute stress it could be as a result of a loss, as a result of illness, something that has come upon an individual and is overwhelming for that person for that moment. Maybe after some times, or treatment, psychotherapy, within the shortest possible time, that stress is gone. That is acute, so it doesn't affect life. But long-term stress, that is a chronic stress, can affect health. It can affect your whole life and people around you, and can lead to depression. When stress is chronic and it overstays, it can lead to depression. That is why it is important that when you identify stress indicators and how stress is affecting you, you need to start working on it, treat it.
Experts say this can lead to long-term chronic health problems. For instance, stress can result in faster pulse or heartbeat and rapid breathing, increased sweating, and create a sick feeling in the stomach, described as butterflies. Stress can lead to persistent headaches, tense feeling, difficulty in concentration, and a sense of frustration. It is, however, the slow decline in hormones and the regularity of arousals that appear to constantly mount a heightened agitation that leads to long-term symptoms of headaches, poor sleep, poor appetite, nervous disposition. Others are fatigue, confusion, and unable to take decisions. This may affect personal appearances, result in mood swings, and lead to dependency on food, excess alcohol intake, tobacco, and narcotics. This can also affect the individual's sex life.
A lot of people are under stress without being aware, and so they take things for granted. There are people going through serious stress indicators. It's showing on them, other people are seeing it, but they don't pay attention to it because they think stress is not sickness. Actually, stress can be more than sickness. It can affect your health in different ways. It can even lead to madness. It's if we don't take it seriously. When you look at starting from families, when families, there are issues in the families, the individual, the mother, the father, the children, the whole home may be suffering from stress. And when they don't take care of that stress, it can lead to other things. It can even lead to paranoia. People become over suspicious of each other in the home. And that can also lead to other mental health issues. So it is important that we treat stress. Stress can also affect drug addiction or drug abuse. And drug abuse can also lead to stress. It's two-way. It can affect each other. Now, when stress affects drug-induced, stress-induced drug addiction, it's because the person or the individual is overwhelmed with stress issues and is not able to deal with things that are confronting them. And they feel that when they take alcohol, they take nicotine, cigarettes and other things, it may give them a relaxing effect. Or cocaine, that is a higher form, heroin, and all the amphetamines that you can think about, anything that can induce kind of relaxation. They think alcohol can be said to be relaxing, to give you a relaxing effect, but it actually depresses you, because as you get addicted to it, your system will start looking for alcohol and become dependent on the alcohol. If it's cocaine, it's going to demand that cocaine. Cocaine actually is the upper. So it rises you as if you are energetic. And usually that is what the young men and our friends in the media, in the entertainment industry, and the rest will use to maybe up their game, especially when they feel that they have to perform, and they feel that they don't have enough energy to do that. They go for this sense to influence their performance, and that's is artificial. So it goes into the system, and over time it affects the system because you get addicted in the first place. And that addiction, it goes to the brain, it breaks things in the brain. You see someone who smoke cannabis or weed for some time, the eyes are red. Why? Because it's having effects in the central lobe, the brain. It's affecting the brain. It's showing on the eye as if you are excited. They feel they are excited, and over time it affects things and affects the organs. That is mental health and physical health issues, just because of trying to get excited for a short time, and then at the long run it affects the whole system and puts you in a way that sometimes it can even send you to the mental home. And as I cited a family, when stress is not treated from the family level, it's men will usually go keep drinking, and in the marriage it can affect the marriage.
The critical question we should ask ourselves is, what are the ways to deal with stress and post-traumatic stress? And the answer is not far-fetched. Medical experts have proposed many ways by which we can reduce stress and post-traumatic stress.
Stress is a part of life. But there's so many things that will calm you down. For some people, it's listening to the type of music that they like. R&B, rhythm and blues, cool Ghanaian music. Some people like Kofi Kanata, some people like Shatta Wale, some people like Stone Boy, some people like Amati Dede, some people, any music can calm you down. Some people like reading. They would sit somewhere, read and distress themselves. Some people go watch a film. You can, these days there are no film theaters, but you can have watch a film. These are all mechanisms of distressing yourself. Some people, it's rest and sleep. But people like that can't sleep very well. So if you decide to use sleep alone, you're not going to get, to what I call the basic equilibrium. Some people go for massage, all right? Some people would meditate. Again, it's almost like bringing your brain activity to an equilibrium, ground zero. So anything that would calm you down would say it's a distressor.
It's very important that you keep stress, you work on stress as early as possible, that it doesn't lead to depression, it doesn't lead to other devastating life effects. And so when you treat it, stress, you can see clinical psychologists, you can see some emerging stress reducing effects. You can also use emotional surgery, which is emerging from Mr. Thompson, which you can also use to reduce stress, and other stress reducers, so that you don't get into depression and its related mental health issues.
Among the many prescribed ways to reduce stress risks is what is termed emotional surgery. Emotional surgery is a new concept introduced by a Ghanaian ICT software engineer and visual artist, Mr. Robert Eko Grimond Thompson.
Emotional surgery is the art of using color coding frequencies and neural navigation ideators to communicate with brain cells. I did this about 20 years ago, but in actual fact, it started when I was 3 years old. Anytime I got reprimanded by my parents, I'll just use that kind of strategy to calm myself. So after going through, other professional courses, I decided to shift a little bit into that. But the main reason why I did this was that medical doctors, they tried their best to help patients. And I realized they have two options. You report to a medical doctor, he will diagnose you, and he will use two strategies, if I should say. Medical, by giving injections, tablets, suspension, IVs, and whatnot. Secondly, he would, if the medical side doesn't work, he may have to check if the thing demands surgery. Now, with surgery, you need to dissect the person, remove a defect, or you correct a defect. What if not any of these two? And I've experienced this, looking at what they've been doing to people, not anything bad, but they try to help people find remedies for their ailments and all that. What if not any of these two that I've mentioned, medical or surgical? Then it means they may have to send the person home. Well, emotional surgery is best experienced. I don't use the same system or strategy on every patient. First of all, I may have to communicate with you. The moment you start talking, the moment you start walking in, the gestures and all that, that would prompt me, or those would prompt me to be able to design what would talk to your brain cells.
8 years ago, I came into contact with a young man called Robert Grimond Thompson. Typically Ghanaian, but the name certainly is no Ghanaian. He comes from Cape Coast and Anomabo, and I don't think anybody will be surprised by the name Robert Grimond Thompson. He's an artist and a software engineer, and he's combined these two in a very ingenious way. He uses colors, various artistic designs, and it has a way of just soothing the brain, all right? So you begin to look at these things and it starts calming you down. Now, the first time I met him, he just asked me to look at a picture. And as I looked at the picture, you know, it almost like what a psychiatrist would do to put you to sleep. And I felt, this thing is strange. Now, if he does it in a moving way and with background music, then it even suits you faster. And he had come up with the name emotional surgery. And the name just hit me, and I said, emotional surgery. And I said, but you know what? This is almost like being given an anesthetic drug. So, if you are going to have surgery, and it is possible, it's one of the most anxious moments in anybody's life. So if, for example, you're diagnosed as having something that requires surgery, and you can go through this emotional surgery prior to the date when you're going to have surgery, then I think that it will calm you down. And that is how I connected with the name emotional surgery. Because the pictures and the artistry calms your emotions down. And once your emotions go down, then your uptake of anesthesia and going through surgery becomes relatively easier. So I thought that it was a very ingenious way of putting those two things together. And that is how come I got to know about emotional surgery. Now, having seen it, having gone through it, I realized that this was a very, very important ingenuity. I'd never seen it anywhere. I'd never read it anywhere. But I thought that this young man had crafted something very unique. The science of sleep has crept into, the medical system now. I mean, when I was a medical student and I became a doctor, nobody thought that something happened in your brain whilst you are asleep. But I tell you, the activities that go on in your brain when you are asleep is even the cause of hypertension, is even the cause of diabetes, non-communicable diseases. Because now it is now believed that if you don't sleep well, then the things that happen in your body during stress happens when you are asleep. So noradrenaline goes up, cortisol is also released, all because of your inability to sleep. So all those things have become part of the processes of what we call insomnia, that is inability to sleep. And people now believe that if you're able to sleep and sleep well for a minimum of 8 hours, irrespective of your age, it helps you to reduce your non-communicable diseases, your hypertension, your diabetes, and etc., etc. Now, if you have it ordinarily, you become stressed. You're worried you're hypertensive, you're worried you're taking drugs all the time, and for most men, if you go on diabetes, antihypertensive drugs for 10 years, then, certain things also, actions of certain parts of your body also decrease. And most men get worried when they get into that difficulty. I believe emotional surgery can be one way of calming you down before you go to sleep. And I say this, that again, if you are a business executive and you have 20 minutes of emotional surgery, you can slot it into your television. It can be put into your television. You sit in a dark room, watch it, and 5 minutes, you're snoring. I believe that if you did that, you will sleep deeply. And that is when you dream dreams. And apparently, it is when you dream that everything you've learned during the day travels on the neural highway into proper storage. And proper storage and proper packaging, so that when you get up in the morning, it is easier to remember what you have learned. I tell you, having read a book by Professor Matthew Walker on why we sleep, I have come to realize that the period we sleep is so integral, so much a part of our everyday activity, and probably even more important, that if you don't sleep, then you have a problem. And in that book, he talks about all the studies that have been done. People who are going to do exams, they say they don't sleep, they'll chew and paw. Immediately they finish the exam, ask them any question, they will not remember anything because they did not sleep. So that acquired knowledge was not properly packaged. And I sat back and I said, I never did mining. For me, the night before an exam, I go and sleep. And I realized that that is what has been my secret. I sleep, I get up in the morning, and I play loud music, and I just charge myself, and I go and do my exam. And luckily for me, I've never had any difficulty in doing exams and passing exams. So emotional surgery, in other words, is cutting your emotions. I mean, surgery is about cutting, and if you're cutting your emotions, then you are diminishing your stress, you're distressing yourself. So it's a very apt name, but I believe sincerely that when people hear it for the first time, they say, what the heck? What is emotional surgery? But if you sit down and think that this is cutting your emotions to size, if you take our military and service personnel who go out on peacekeeping, only God knows what they encounter there. It's not peacekeeping. They go and keep peace, but they go into war-torn areas to keep peace. So the kind of things that they get exposed to, and all of us have seen Iraqi veterans, post-Libya veterans, all those people, those who went to Kuwait in the Iraq-Kuwait war, a lot of them have gone into serious depression, and some have committed suicide.
Emotional surgery also removes negative reactions from the human mind. This gives the brain relief and unable to relax from internal and external stresses. The mechanisms also helps to assist health professionals treat post-traumatic stress disorders, PTSD, and traumatic brain injury, TBI, among many others. This therapeutic programming software promotes brain cell coordination through the use of color psychology. Mr. Thompson explained.
The problem is within the brain cells and the software, the mind. So if you're able to communicate or put these two together, you correct the problem within the mind, you correct the problem within the brain, which is the hardware, you should be able to solve the problem easily. And it's very simple. It's just like an aeroplane. Okay, before it takes off, all right, it starts to be on the runway for some time, then it takes off. Now, once it takes off, it's representing you working at the office. After close of work, the plane is landing. It has to land gently. So when you go home after close of work, don't just take your bath and jump into bed. No, you have to calm down the brain by using emotional surgery. That is it. Now, a lot of executives make mistakes. They resort to very hard liquor. When you resort to very hard liquor, you know what it does to you. It litters the brain. They will tell you that it makes them sleep. That's not true. It doesn't make you sleep. It litters the brain. And after a while, later on in life, it's going to attack you titanically. And that will put you to death. If you are not able to tune the body's rhythm to its base equilibrium, the genes within your system, the gene is the unit structure of biological life. They form the whole human system. If you do not sleep for more than the required number of hours, like adults, we need to sleep for more than 8 hours or 8 hours minimum. Anything below that would change, would distort your genes. Now, it has been found that if you do not sleep for 8 hours, your genes will get distorted. 700 of them will get distorted. When they get distorted, half of the 711 plus are the engineers of cancers, of all the cancers that we have in this world. The cancer, the tumor, the prostate cancer, everything is from that changing gene activity. That is what is causing all the cancers we have in this world.
Post-traumatic stress disorder virtually is a loop within the limbic system. And when I say limbic system, it's a system within the brain. And whenever there's a panic attack or any stressful event, and it keeps repeating itself, the amygdala, which is the panic system, has to prompt the hippocampus, which stays within the limbic system. Now, in this case, the hippocampus has to report to the forecortex to instruct the amygdala to stop the alarm system, else it will be looping. And this is what causes post-traumatic stress disorder. It will affect productivity and the way you conduct yourself, the way you think, the way you talk, the way you solve. You will not be able to solve any problem that would make sense to anybody.
I believe sincerely that any person diagnosed and being prepared for surgery can go through a short period introduction to emotional surgery. It calms the body, it calms the brain down, and it prepares you for surgery without that anxiety that most people have when they're going for surgery. Beyond surgery, I believe that clinical psychologists who see people with traumatic syndromes and post-traumatic stress syndromes can use this also to calm people down so that at the end of the day, probably whatever treatment that they give to them probably will be more effective. So I would say, yes, I would recommend it. And I recommend it to the Department of Anesthesia, Department of Psychiatry, and to all surgical departments, and say that it is something that is very important. Now, even business executives who are in that stressful, look, you can get a video clip of it, 10 minutes, 15 minutes, 30 minutes. Most people will not last 10 minutes watching emotional surgery. They'll sleep by the time they get to 10 minutes. It is that effective because it is almost like all of a sudden bringing your body into equilibrium and bringing your brain and your body to ground zero. And if there's anything that can calm you that way, then I think it is something that is really super. I've gone through it, I like it, and I'm usually not a very overstressed person because I find my own ways of de-stressing. But it is something that I have at any time. I can just put it into my computer, sit there, and most of the time, within 10 minutes, I'm gone. Any evening that I have difficulty sleeping, I use it.
Experts, however, recommend that individuals find convenient and better ways to de-stress at all times. This is Diana Lord enforcing from the GTB documentary section Accra.